If you're looking for information about arthritis, and particularly the signs of arthritis, then this is a video for you. Hello everyone, this is Dr. Jason West, and we're going to talk about the signs of arthritis, because arthritis is very common but misunderstood. And actually, arthritis is not even a single disease. It's an informal way of referring to joint pain or joint disease. It's kind of like saying we have a headache. Well, that doesn't tell you what kind of headache you have. It could be a cluster headache, a migraine headache, a TMJ headache, a hormone headache. In the same way about arthritis. Arthritis means that the joint is irritated, and those are over 100 different types of arthritis. People of all ages, sexes, and races can and do have arthritis, and it's the leading cause of disability in America. More than 50 million people and 300,000 children have some type of arthritis. And it's most common among women and occurs more frequently as you matriculate down the road of life. Now, arthritis symptoms can include swelling, joint stiffness, and decreased range of motion. And symptoms, they can come and they can go, and they can be mild, moderate, or severe. And they may stay for a short time period, or they can be chronic. They can be progressive, they can get worse over time, or they can be acute. Now, severe arthritis can result in chronic pain, the ability to not do your daily activities, making it difficult to walk or climb stairs, and arthritis can cause permanent joint changes. And sometimes you can see them. Like, you can have these things called Hebridean's nose on your fingers. You can see them on x-ray. And some types of arthritis can bother the organs and tissues, like your eyes, your lungs, your heart, your skin. And like I said before, there's over 100 different types of arthritis. So let's talk about some of the most common kinds. The most common kind really is known as osteoarthritis, or degenerative joint arthritis. Literally, the joints wear out. Your joint's supposed to be here and here. There's a real nice space in between them like this, and what happens is over time, from trauma, from stress, from overuse, or sometimes just even age, the joints come closer together. There's a sensitive membrane around the bones called the periosteum, and when the periosteum of the different bones touch each other, it hurts and it doesn't feel very good. The joints can just wear out from overuse. You can have trauma. Weight is really, really hard on joints, and we call it the rule of fours. If you're going upstairs, you usually about 4 times your body weight on the joints. If you're going downstairs, about 4 times your body weight. So I'm 190 pounds. So essentially, if you go upstairs, it's like 760 pounds, or if you go downstairs, 760 pounds. So every pound that you get off of your body literally is like subtracting 4 pounds of weight. It's so important to have activity and movement when you're having degenerative joint disease or osteoarthritis. It's really a lot better for you. Now, you can have inflammatory arthritis, which can be affected by the genetics, environment, and I see a lot of food allergies associated with inflammatory arthritis. So I see people that do really well avoiding inflammatory foods. If you can reduce the gluten intake, and it doesn't always mean that you have celiac disease or you're gluten sensitive, but I issue this challenge to people. Just try and avoid wheat for a while and see how your joints feel. And almost invariably, people start feeling a lot better. Now, I think one of the biggest causes of arthritis is infection arthritis. We get some type of microorganism, usually a bacteria. Sometimes it could be a fungus or a virus that gets into that joint area. The body goes in to get it with an immune system. It creates some inflammation, but long-term chronic health problems like rheumatoid arthritis, some lupus involvement, Sjogren's disease, I think are bacterial and microorganism caused. And if you make the immune system healthier, it really, really helps. If you put people on something that decreases the immune system, I'm not sure that that's the best way to take care of them. Now, I certainly believe that there are certain instances that that's a consideration. But by and large, just making the immune system having no inflammatory response, I just don't think that's a good long-term solution. Now, the other contributing factor for one of the main problems with arthritis is metabolic, especially gout, which is the improper breakdown of proteins. Now, when that happens, it's like putting ground up glass crystals in the joint. It's one of the things that I'd really like to skip in the office. I see a lot of pain associated with arthritis. It's hot, and I think that pork and soda pop and caffeine are all contributing factors. If you improve digestion and you help people to get rid of some of the risk factors in their life, you can really improve gout long term. And trust me, once you've had gout, you never want to have it again. Now let's talk about the 7 signs of arthritis that you should not ignore. The first one, if you're having a lot of pain and you have associated with a fever, that's something that you need to have checked out. Run some simple, inexpensive labs and make sure that there's not a developing infection, because sometimes in the infection in the joint, it's irreversible damage. The second sign of arthritis you should not ignore is digestive issues. You can have called psoriatic arthritis or enteropathic arthritis, so a skin arthritis or digestive arthritis can be aggravated and affected by what you're putting into your system. And one of the recommendations that I tell people, avoid wheat, avoid dairy, avoid soy, avoid artificial food flavorings, and see what happens with your joint, because the proof's in the pudding. I don't think you have to go out and spend $3,000, $4,000, $5,000 in testing. If you'll just avoid those inflammatory foods for a short time period, I think you'll be so much better. Now, reduced breathing is also a concern with arthritis because it may be an autoimmune signal, and unexplained vision loss could be autoimmune for MS, could be a risk factor for rheumatoid arthritis or lupus, and then changes in moods can be aggravated by medications, by stress, by food, by over-the-counter medicines. But moods and arthritis, because you don't feel like moving, what happens is it has a tendency to make it so that your mind isn't as healthy as it should be. You can't separate the body from the mind and the mind from the body. The other thing you want to be concerned about is chest pains, because it can be a risk factor or identifying symptom for rheumatoid arthritis or another type of cartilage disorder called costochondritis. And then the number one concern with arthritis is numbness, because it may indicate nerve damage from either a nerve disease, malnutrition, or a lack of oxygen. And what happens is if the numbness occurs and you can't hold things, you can't open doors, you can't feel your feet, and then it gets into the joints, it has the tendency to make the joint damage more severe. So now that we've talked about the signs of arthritis, a little bit about the types of arthritis, in the next videos on the channel, we're going to talk about what to do about arthritis. This is Dr. Jason West, and we'll see you on the next video.